This is Tom Bernacki, and today we're asking the question, do eggs raise the risk of blood clots and arterial sclerosis? And we're starting now. What a great picture by Nutrition with Judy. Look at all the vitamins and minerals in eggs. A cardiologist recently told me that eggs are the single best and most reliable natural vitamin source in the world, better than any multivitamin. So this is essentially a battle of cholesterol versus how many amazing vitamins and minerals are inside eggs. We're going to go over all the studies, what wins in the end. This is a big time showdown. Who do you think will win? There are just so many high quality studies at this point. We're talking hundreds and hundreds of thousands of patients as proof. Are eggs good or bad for the heart? There's still some debate. Do they raise cholesterol levels? Should you avoid them, or should you be eating like 6 a day? So when I look at the health statistics for 3 eggs, that's 561 milligrams of your daily cholesterol value. That's 15 grams of fat, so 23% of your daily fat. That's 4.8 grams of saturated fat. That's a quarter of your daily saturated fat. When I was doing my video on blood clots, I saw one of the most Googled questions are, do eggs raise the risk of blood clots? Now, I did another video, which is like way over 1 million views, talking about all the new studies about cholesterol, about eggs, about some of the corruption in the studies on both sides. I think the result is pretty undeniable, but here's the big scam. In 1961, there was a guy, Ancel Keys. He talked about saturated fats and dietary cholesterol. He was kind of like the big leader that got people off fats onto sugars. And the myth is now challenged, and there has been a lot of controversies. Some people, not me specifically, because I don't want to get sued, have made corruption and unethical practice accusations towards the health food industry and this specific guy. There are some very courageous doctors and practitioners that actually dig into these studies and attacks the mainstream narrative, like Dr. Ken Berry, who goes into these studies and is willing to actually call out the medical societies, and Dr. Shawn Baker. I'm not saying this is the right answer, but it is an answer that's very well backed up by sources. There are specific debates on how this was all corrupt studies that guided this country to adopt a high sugar, low fat diet. Specifically, the 7 countries study. Ancel Keys conducted the famous 7 countries study, which looked at the relationship between diet, lifestyle, cardiovascular disease in different countries. And critics said that Mr. Keys specifically ignored certain countries. So it's called the French paradox. Some countries that had high fat had more heart attacks, but France, they have a lot of cheese, a lot of fat, a lot of butter, and relatively low heart attacks. Hey, let's not include that as part of our 7 countries. There's accusations of cherry picking of data. That data from certain countries did not align, and even beyond France, this was used to inflate dietary fat and heart disease statistics. So not just that, but he was a very influential figure in saying that America needs to reduce its fat and help guide public policies. Critics say that this was not proper. And what it always comes down to, a conflict of interest. It just so happens that almost every single person making these recommendations has financial ties to the food industry, specifically the vegetable oil industry, for this guy in particular. So listen, if somebody's giving me a lot of money, it makes it very hard for me to say bad things about that person. So if somebody wants to give me money, I will say very nice. No, I'm just kidding. Otherwise, I couldn't make videos like this. Blood clots are a major contributor to our health issues, and look at our expected lifespan in America. This is terrible. We've got to do better as a country and around the world. I have a dream that these videos can help more and more people. So that's the sole intent of this video. So hit up the likes, hit up the comments, and help these videos get more reach. Me, as a foot and ankle surgeon, I see a lot of deep vein thrombosis, a lot of clots. I've done a lot of videos about blood clots that have had a lot of views, all the statistics, take an aspirin, what should you do? And I see this question quite a bit about eggs and blood clots. But first, most people are confused about what a blood clot actually is. Blood flow on the way down to our legs is called our arteries. Blood flow on the way back up to our heart is called a vein. Narrowing of our arteries on the way down could be arteriosclerosis, or if it's fat, it's called atherosclerosis, or if it's calcium, it could be calcification. If you get a cut or some damage on the vessel lining, you could develop a blood clot technically, but this is more rare. Where clots are more famous is on the way back up because our venous flow is lower pressure, it's lower speed, the blood flow can slow down a little bit. If there's damage on the walls due to long-term damage, our diet potentially inflammation, then those platelets can start to congeal together and form what's called a blood clot. The risk of that is if that blood clot shoots up to our heart, to our brain, to our lungs, the biggest problem that can develop is called the pulmonary embolism. And this has about a 50% chance of death. If a blood clot breaks free and shoots into your lungs, it could plug and shut down half your lungs and you could die very rapidly. And this is very serious. I have had this happen after surgeries in the past. I had somebody in my neighborhood have this problem. And unfortunately, as time is going on, I did a video about life insurance rates going up, blood clot rates going up. Check out the statistics on that below. But the sad statistics are almost 50% of adults in the United States will develop artery narrowing or arteriosclerosis, and more people than ever are developing blood clots in their veins. So one way to check for a blood clot at home is something called the Homan test, which is essentially checking the calf, bending the toes. The symptoms of a blood clot are usually one leg is a lot more swollen, irritated, or injured than the other one. It's not always this easy, but usually it is for me. When somebody comes in after an injury, a surgery with high risk factors, one leg is much more swollen than the other. And what happens is you can bend that foot up, and as that moves that calf, it's painful. I mean, really painful. You could squeeze that calf. You could push with your fingers on that clot area, and it's really painful. Not that that's 100%, but that's what makes you want to get a venous ultrasound test at that point. And you can go to any ER. They will squeeze you in immediately because this is considered something a little bit more urgent. Or you could go to a vein clinic. They will do this for you as well. And it looks just like this. But let's talk about eggs and blood clots. Now that you understand what a blood clot is, the relationship between eggs and blood clot has been studied in depth. When I go search on studies, the Cochrane database, PubMed, there is no direct link between eating eggs and increased risk of blood clots. In fact, the American Journal of Medicine did a large-scale study encompassing 3 large prospective studies and an updated meta-analysis. This means they looked at a lot of different studies going forward, and they found that moderate egg consumption is not associated with any risk of cardiovascular disease. This conclusion suggests that moderate egg intake, and that's like 2 eggs a day, did not impact the risk factors for blood clot formation at all. You don't have to worry about blood clots and eggs. Moreover, a recent 2021 study published in the American Journal of Medicine specifically investigated the impact of egg consumption on blood clot risk factors. This study found that consuming eggs alone did not lead to an elevation in trimethylene N-oxide, or TMAO. This did not enhance platelet response in the healthy volunteers that they studied. TMAO elevation and increased platelet responsiveness are high risk factors for blood clotting event like heart attacks and strokes. This second study further supports the idea that egg consumption in and of itself does not directly link to any form of blood clots. Now, the big question, I think people are confusing this, is cholesterol and heart disease. This is really the hot topic. And again, check out my video with 1 million views. I'm going to summarize it here without going into depth on those studies. Eggs, particularly in the yolks, are high in cholesterol. When I look at the health statistics for 3 eggs, that's 561 milligrams of your daily cholesterol value. That's 15 grams of fat. So 23% of your daily fat. That's 4.8 grams of saturated fat. That's a quarter of your daily saturated fat. Historically, people assumed if you're eating a lot of cholesterol from egg yolks, you're getting a lot of cholesterol in your blood. So historically, they thought you'd get more blood clots, more arteriosclerosis, but recent research suggests that dietary cholesterol has a less significant impact on blood cholesterol levels than previously thought. for most people. And in fact, there are so many high-level studies now almost completely disproving this. Nothing in this world is ever 100%. I got attacked a lot in my previous videos. In fact, there was a vegan guy who found my offices and tried to bomb me with 1-star reviews. So I appreciate when you guys give me nice office reviews. But this vegan guy really caused a lot of trouble and said some hateful things. And unfortunately, Google's not removing these bad reviews. My dream is not to politically attack the left or the right. I don't believe in this. I think this divides us and it stops us from looking at the studies and the truth, and it hurts our health. So let's all get along. I care about you guys and I want nothing but the best of health for all of my watchers here and all of my patients. The journal Nutrients performed a meta-analysis in 2020. They looked at a lot of different studies. They looked at randomized control trials, which are very high level, and explored the association between egg consumption and cholesterol concentration. This study looked at analysis of different quantities of egg consumptions on low-density lipoproteins, which are the bad cholesterol, and high-density lipoproteins, which are the good cholesterol, and the LDL-HDL ratios. The results showed various impacts, but essentially it did not raise the bad cholesterol, and it did raise the good cholesterol. Now, the good cholesterol actually goes around and picks up the bad cholesterol out of your arteries, so you want more good cholesterol. So the studies, I think at this point, are pretty clear that there's no strong evidence that eggs cause blood clots. There's no strong evidence that eggs cause arteriosclerosis in any significant way. And in fact, Frank Hugh, the chair of the Department of Nutrition at Harvard School of Public Health, recently emphasized very clearly, there's no evidence that eggs and dietary cholesterol can raise your risk of heart disease. These guidelines recommend a balanced diet with a focus on fruits, vegetables, whole grain, nuts, legumes, but you can also eat meat, you can also eat eggs. In moderate amounts, it's not shown to really make any difference. Now, no one's even saying you can't eat a ton of eggs. Maybe, who knows? I have people commenting in the video saying they eat 12 eggs and they're not in bad shape. Actually, tell me your stories. I love these comments. If you eat a lot of eggs and you've checked your cholesterol, that's very helpful for your this channel. Or if you do eat eggs and your cholesterol shot up, let us know too. Sometimes in these videos, when we get like 1 million views, this gives us even more consensus than some of these studies. One thing that I really want to touch on is Dr. Shawn Baker and the carnivore diet. He wrote the carnivore diet book, and this guy eats nothing but meat and eggs. He eats like 10, 12 eggs every single day, and look at how great of a shape he's in. He has numerous world records in cardiovascular events like rowing, and what happens is countries like Hong Kong that eat more meat than anybody else are actually #1 in the world in terms of lifespan. Now, I'm not saying that's the only factor, but you have to look at India, for example, which admittedly is a poorer country on average, but they have a much higher percentage of vegetable eating, and they have an extremely high level of cardiovascular issues. If you look at the countries, and Google this right now if you don't believe me, but the countries that eat the most meat generally have the longest lifespans in the world. Something very interesting to consider. Now, on the other hand, eggs are rich in omega-3 fatty acids, especially farm-raised eggs. They are known to have a blood-thinning effect, which could potentially reduce the risk of blood clotting. These are extremely high-level studies, but a meta-analysis with almost 150,000 patients across numerous studies showed that omega-3 fatty acids are extremely heart healthy, arteriosclerosis healthy, and heart attack healthy. And in fact, there's almost no evidence of blood clots with eggs. So take a look at eggs. They do have omega-3 fatty acids. Normal eggs don't have a ton, but they do have a decent amount, whereas organic and omega-3 enriched eggs or farm-raised eggs can have significantly more omega-3 fatty acids. So the point here is that there are components in eggs that are extremely heart healthy and actually prevent things like blood clots. And then number 2, eggs and egg yolks specifically have vitamin K2, and vitamin K2 is shown to lower calcification rates in the arteries potentially. There's a lot of ongoing research. Vitamin K2 is extremely deficient in our diet. The World Health Organization and the FAO estimate that only 5 to 25% of our daily values is reached by the average person. And eggs are a great source of this. Calcification of arteries is a very big problem these days. It is one of the major causes of arterial stiffening. Take a look at this CT angiogram. This is someone with calcified, and that means bone in your arteries. It stiffens them so they're not flexible. It decreases the blood flow. You get cold toes or blood flow. As a foot and ankle specialist, I check the posterior tibial artery pulse, the anterior tibial artery pulse. This sets a good guideline. If those feel great, then you don't have to do much more. And the way you feel it is bounding pulses up and down. And we also check the capillary refill time. That means when you squeeze the toe, does it refill instantly? If it doesn't, if it's more than 3 seconds, we can use a computer to perform a test. We could perform what's called an ankle brachial index. So that's basically comparing your arms to your feet. Are there potential blockages somewhere? And if there are blockages, so for example, if one ankle is much worse flow than the other or compared to your arms, then we might want to do more testing. You can check the toes and then you can order imaging. You can get what's called a CT angiogram. But what I do is I work with a vascular surgery team. So I work with great vascular surgeons. Essentially right away, they can do a test which is an angiogram, or they can release dye. They can essentially check if anything's narrowed or blocked, and then you can correct it. So this is one of the images where you could see, is there cholesterol built up? Is there a plaque? Is there calcification? But one of the things that can really help with this is vitamin K2. You want to get that calcium into your bone. So studies show vitamin K2 is very beneficial with patients with aortic valve calcification, and a couple other studies too, combined with vitamin D. Now, it won't reverse your arteriosclerosis and make you like a baby again, but it can prevent it from getting worse. And especially the earlier you start, the more benefit it can have. A cardiologist recently told me that eggs are the healthiest multivitamin in the world. And in regards to vitamin K2, this is very true. We need 90 to 180 micrograms per day. And look at this list. Number 4 on the list is eggs. If you eat 3 eggs, you essentially can reach this recommended amount. But otherwise, you have to eat goose liver pate, which I don't even know where to get that from. Or you have to eat high amounts of hard cheeses or soft cheeses. Otherwise, you're hardly getting any vitamin K2. And there have been studies, a meta-analysis looked at 222,000 patients, and vitamin K2 and vitamin K overall was related to lower heart disease, mortality, lower stroke, and lower rates of clots. So the big secret is this. There is no clear consensus that eggs raise your cholesterol. Historically, because there's cholesterol in the egg yolk, people thought you'd have high cholesterol in the blood. That's kind of been disproven. And when you cancel out the cholesterol, you have to look at all the vitamins, your B vitamins, your omega-3 fatty acids, your vitamin K2. This is one of the best and most practical sources of vitamin K2, and this can be something that's very heart healthy and artery healthy. Look at all these vitamins. A cardiologist once strongly told me this is the single most reliable and proven multivitamin. When you take the store-bought vitamins, you don't know what's in there, but with an egg, you know what's in there. So it might be the opposite. The egg might actually even be heart healthy. In the video below, I go over a lot of the accusations of payoffs and money-making schemes that were resulting for these types of studies in the past. What really determines your cholesterol levels, your arteriosclerosis, your blood clot risks is your lifestyle factors. Do you smoke? Do you drink alcohol? Do you eat high sugar foods? Are you obese? Are you genetically predisposed? Unfortunately, some people have genetic issues and certain medical conditions like diabetes, inactivity, certain medications, certain infections. This is way more important than eggs. Even though there are some people that could be so sensitive to eggs, these other things are just so much more important. My top 5 secrets in order: strength training, very well proven. Strong muscles increase good hormones, decrease inflammation, raise your health more than anything. Number 2, Cardiovascular activity. I have a guide, how to start a walking program at any age. Very important to get your steps in. It will give you longer life, better health. Number 3, great sleep. I go over my sleep guides, but people who sleep 7 to 8 hours a night are on average way healthier than people who sleep less than 6 hours a night. Blood sugar, diabetes, stress, everything. Then number 4 is diet. Yes, I put 3 things above diet. And then number 5, if that doesn't work, supplements, medications, all that kind of things at the bottom of the pyramid. If that helped, check out my full egg video.